Physical therapy is an interesting career because it has one focus, the rehabilitation of a patient after an injury or surgery. Though it is so specific as a career, there are a variety of places, specializations, and types of people one can work in. According to NEMCO, physical therapists work in places such as hospitals, schools, physical therapy clinics, physicians' offices, patients' homes, and other locations as well. According to the APTA, there are opportunities to be certified in specializations of cardiopulmonary, clinical electrophysiology, neurology, orthopedics, pediatrics, sports, women's health, and geriatric physical therapy. One may work with children, young adults, or older adults with a variety of conditions based on the location and the type of therapy a physical therapist specializes in. According to Laura and Verardi, one who specializes in geriatric physical therapy deals with issues with older adults such as arthritis, osteoporosis, cancer, Alzheimer's disease, hip and joint replacement, balance disorders. Geriatric physical therapists work to assist in patients to help restore mobility, reduce pain, and increase fitness. There are many positive aspects about working with geriatric patients. What would make one interested in the geriatric physical therapy field?
As a student, you would want to lean towards geriatric care because you're interested in helping people. And in geriatric patients, you have some of the most severe cases of diseases or conditions. And as a physical therapist, you can actually bring them back to a normal state for their age group. So you see the almost like an immediate, but not like a day, but like in a short term to get them back to normal. Also with geriatrics is a lot of home care, so that you really won't have to sit in an office. You'll have different scenery all the time. You can travel. It's not a day-to-day, consistent, the same thing every day.
How do you think geriatric patients are different from other patients?
Geriatric patients are a lot different than other patients. Some of their symptoms are different between a younger person might have a certain symptom, and then geriatric might have a similar symptom but have a different variation because of their age. Some of the wear and tear in their body, it affects some of their conditions. Postures over the years can actually affect how they move, how they work. Also, sometimes, like some of the elderly, I can't really be specific to all elderly or geriatric patients, but they want to be motivated because they want to be doing other things, not just independent. So it makes them more focused, more compliant to do their exercises. With younger patients, it would be some of them might have workers' comp, so they don't want to do things because they just want to get paid and not have to go back to work. And even younger than that, for children, their attention span is really short, so you have to focus their attention on things. So they're a lot more maintenance and a lot more, not really maintenance, but to have more of your attention on them and be able to direct them so they will follow what you want them to do.
So I think some of the benefits of working in the geriatric field of physical therapy versus other fields, I find, at least at the subacute rehab that I work at, the patients seem very grateful for everything that you do for them. So I don't know if that has to do with their age or just the patients that are at the nursing home that I work at, but they seem to listen to what it is that I have to recommend and will follow through on those recommendations. When I've worked in pediatrics, sometimes it's very challenging because they have a very short attention span and you have to make everything a game, where with an older adult, you tell them, this is why I want you to do this exercise, this is how it's going to benefit you, and for the most part, they follow through on that. So I would say, that's a huge benefit over other professions. I also think they've lived through so much. They're living historians there, so I just love listening to their stories. And that, I think being able to establish a rapport with the patient is huge as far as motivating them and, getting to know who they are. I think, that just helps with the whole healing process as well.
Why do you think many enter the field?
I think that many folks enter the field of geriatrics because of the patients themselves, that they're so rich in history. They all have a tremendous story to tell. And it's very rewarding to see them improve their function and get better. The area of geriatric physical therapy certainly has grown over the years, and of recently we know of our population that it's really an aging population, so there is a much greater need for physical therapists in the geriatric area. We've really kind of honed our skills and specialized in treating individuals who are aging, knowing that it's really just this next phase of the continuum of life, and that we really have a niche as physical therapists to help people function better there.
I plan to go into physical therapy field specializing in geriatrics. I chose this field because I enjoy the types of people I am working with, and I want to work in outpatient clinics. Geriatric physical therapy is a great career to go into because of the elderly patients you work with and how so many are so appreciative of how you are helping them. There are interesting cases one may work with the geriatric patient, such as balance disorders and joint replacements. Not only is geriatric physical therapy an enjoyable career, but it is also in dire need. As the years progress and the amount of elderly patients are expected to increase due to the baby boomers. Overall, geriatric physical therapy is a great field to specialize in, and that it is in great need and can be very rewarding.